Welcome to our another episode of Well Beyond Numbers. I'm your host, Dennis Coral from Coral Wealth Management. And I first have to say thank you, Dr. Ray, for sharing so much information. And this episode, it's kind of more fun off the cuff. And we just want to know about the things that drive you crazy. We always, every time we invite our guests, we want to know the things in their profession that we either wish we knew or that we didn't do,
Yeah.
or things that kind of drive you crazy in the profession, more a little bit off the cuff. For example, when it comes to tax season for us, we always usually wait till the last minute to make your IRA contributions or retirement contributions to your business. And although we do them for our clients, that drives us crazy.
Yeah.
Sometimes when we advise clients to stay on a budget and they don't follow it, that drives us crazy because at the end of the day, we will always want to help our clients be successful and not have to worry about money. But I know that in other professions, we always want to know our guests what is it that their patients
Yeah.
should stop doing or should be more aware.
Yeah. I mean, I'll tell you that for me, the easiest one is, I'll typically have a follow up with my patients after we give them the initial review, and I know it's a lot of information. Like I go line by line. This is what CBC means. This is what your cholesterol means. This is what's happening. This is why we need to make these changes. And so I'll spend, a good hour and a half, sometimes 2 hours explaining the tests and the treatment plan. And 2 weeks go by and we'll speak on the phone or in person or on Zoom. And the first question I ask is, how's it going with the supplements? Oh, I haven't started yet. Or, oh, I tried them for a couple days, but then like I couldn't get the timing right. Or, so, okay, so you haven't been compliant with the supplements. All right, number one. All right, your dietary changes. We talked about intermittent fasting. We talked about not avoiding, or we talked about avoiding carbohydrates completely for breakfast. How's that going? Tell me about those changes. Huh. Well, I haven't been able to do the fasting, and yeah, I haven't changed my breakfast. I'm like, okay, so you're not compliant in that either. All right, well, then I'm sure you've done your exercise that we talked about, right? How's your exercise going? It's just I've been really busy, and my sister's in town, and I haven't had the chance to get started with it. So I'm like, okay, so you haven't done anything that I've asked you to do for the past 2 weeks. How are you feeling? And they're like, oh, I feel the same. I'm like, are you surprised by that? How are we going to make a change if you don't make any changes? So I always tell people in my 2 week follow up with them, I'm either going to put on my drill sergeant hat and I'm going to tell them, like, look, if you don't do what you need to do, you're going to be saying that what I do doesn't work. And that's not true because you need to follow through. I've led many horses to water and not have them drink, but if they're thirsty enough, they will. So, or I'll tell them, like, I'm going to put on my cheerleader outfit and say, way to go. You're doing exactly what you need to do. And for those of you who can see this and aren't just hearing it, don't picture that, please. But yeah, so that's really, I think, the number one thing that drives me crazy is just the non-compliance, when somebody comes in. I see people, they've seen every ologist by the time they get to me most of the time, Again, nobody knows. Let me just go find a chiropractic internist,
Mhm.
right? So they end up hearing about me from a friend to a friend, or they overheard two people talking in the bathroom and they're like, oh, I need that guy's information. These are all ways that people typically find me, believe it or
Wow.
not. Yeah. Um, so it's like you found me, you sought me out, you spend the money on these tests, what's stopping you from making these changes? That's what we got to work on because until we can do that, we're never going to get to where you want to be. So that always drives me crazy. Another thing that will drive me crazy is here's what our recommendations are. Here's everything that's going on. And then I'll get the researcher, which is what about this and this and that and this and all these things. And I think this one is probably not what I should be doing because of this and because of that. And I'm like, this one doesn't drive me as crazy because I love it when patients are like advocating for themselves. And I have actually learned things from patients in these situations before. I'm never like, oh, shut all that down and just do what I told you, I'll look at it and a lot of times I'll be like, oh, you know what? Actually, that does make some sense. That might fit your lifestyle a little bit more. Let's try that. Let's do that. But it still drives me crazy because it's a bunch more time that I need to spend with them at that point.
Right.
But at the end of the day, that's a good I'd like to be driven more crazy that way than the first way.
Yeah, yeah, I agree. I agree. You have been mentioning that you spent an hour with a patient, and that surprises me, to be honest, because my doctor sees me 6 minutes tops,
Right.
um, once every 6 months, and that's saying much. So you do take care of your. It sounds that you do take care of your clients, but just get to know them as well.
Oh yeah, for sure. I mean,
And
health is not just, what medicine should you take? That's the problem that we have in America, because let's say you go to your medical doctor and you have a problem. If he doesn't give you a medication, what has he done for you? Or she, what have they done for you? It's like, oh man, I went to my doctor and I'm sick, and he didn't give me an antibiotic, and I'm like, well, that's because you have a virus. You know, well, why didn't they do anything for me? What can they do? Now, in my office, I'll give you herbs. I'll put you in my infrared sauna. We'll get you a Myers cocktail IV. We'll do an adjustment, and we'll have you feeling way better, way quicker. But there's a big difference between what we do with medicine and what we do with natural medicine and holistic medicine, and supporting the body's function and improving the body's function. And there's just a lot of tools that we have that medical doctors don't. And again, like we said earlier, I really see a shift happening where people are looking for this more. So I'm super grateful for the opportunity to be here to reach more people and tell them about that, because that's my goal: help as many people as I possibly can. I would love to have a primary care office with doctors that have my certification in every town, in every city, everywhere, because I would know that we would be preventing more heart disease, we would be preventing more cancer, we'd be preventing more osteoporosis and falls, and older people who fall and fracture their hip, life expectancy is 1 year.
wow,
There's so many ways that this can be prevented, and it's not just, oh, go and do your monthly injection to prevent your osteoporosis. There's so many things that can be done that just aren't being done. And yes, it's an investment, but at the same time, the more people that do it, the less expensive it becomes, right? Because of competition, and because these labs will be able to improve their technology and all these things. So um, I'm very happy with the way things are going. Very grateful to be here to talk about those things as well, and just educate as many people as possible, because that's really where health and power come from. It's all education.
yeah, and your health is your wealth. You could have millions of dollars in the bank,
Yeah.
and if you're not have your health, you're gonna spend all your wealth in taking care of your health,
Trying to get it back,
trying to
right?
get it back to
Yeah.
what it was. And that's so true. And I do see it in my practice,
Yeah.
and I see it. And I'm not a doctor. I just help clients with their finances, get them all organized. But their health is becoming more important as they get older, as we all get older.
Yeah, for sure.
And not neglecting it can also help you. As I learned from you, you can be proactive and you can stop some diseases from becoming real diseases for the
Yeah.
rest of your life. So thank you so much for sharing all this information. And I also have one more question. We always ask this to our guests. Is there a life changing book that you had, or a book that you're reading that you would recommend to our audience that you think it was impactful to you? Uh,
Yeah, there is one that's impactful for me. I mentioned it a little bit earlier, and I thought that this was really appropriate for my patients as well. But one of my wife's friends actually gave me this book, knowing a little bit about my past. So, my brother was shot and killed at the age of 28.
oh,
And
I'm sorry.
yeah, it was a very difficult, situation for my family and I. And we started a foundation in his name, and we raised thousands of dollars, and we connected our organization called the Love Like RT Foundation with the Guitars Over Guns organization, who take kids off of the street and help them, uh, you know, learn music and teach them how to rap or play instruments or do things. And my brother made music as well, so it was like a perfect cohesion, and that's something that really helped me get through that trauma, of losing my brother. And the book that she gave me was called The Body Keeps the Score. And that book helped me to understand how trauma affects every person differently. And that really helped me be a lot more empathetic with my patients, and to understand that emotional side of their ability to heal as well. So, everybody who comes into my office, I give them something called an ACE questionnaire, an Adverse Childhood Experience questionnaire. And I know that whenever people score above a certain number on there because of experiences they had from their childhood, it's going to be a much more difficult road in helping them heal. So that was extremely impactful for me as a provider to help improve my quality of care for each individual that comes through the door.
Wow, that's amazing. I did not know that about your brother. I'm
Yeah,
sorry that he passed, and that's nice that you're doing that to give back to the community and improve and make people's lives truly better. Because it is true, a lot of the traumas that we carry as individuals, and we all have things. No one is, comes from our childhoods.
for sure.
It starts there, and if it's not treated, it'll carry on either to your next relationships or to the people that you live or the people that you
Or your
surround
health.
yourself
It
or
can
your health.
it can manifest in your health
It
for
can
sure.
manifest in your health.
Yeah.
Wow. Wow. Well, guitars over guns.
Gu- Uh, yes, Guitars Over Guns organization. They are a great organization. Um, Very thankful for them for taking us under their wing and helping us to, tell my brother's story because it was all about him being in the wrong place at the wrong time because he chose to be with the wrong people.
Yeah.
And making those choices is something that we were able to help, educate kids, uh, at that very influential age to say, hey, make sure you pick the right friends
Yep.
because you tell me who your five closest friends are.
Tell you who you are.
Right. So,
Thank you so much for
yeah.
being here, Dr. Ray. This has been great. A wealth of information for all our audience and also myself. I learned so much from being with you just in the last hour. So thanks so much. I hope you enjoy this episode of Wealth Beyond Numbers, where we focus on health and wellness. This is your host, Dennis Coral from Coral Wealth Management. And as we like to say in our company, financial confidence starts here. I hope you enjoy this episode and stay tuned for our next coming episodes of other amazing guests. Thank you for watching.